Okay, so this is part 2 of chapter 11. This section discusses inner ear disorders. So disorders of the cochlea, potentially the auditory nerve. So just to review, the outer ear system, middle ear system beginning at the tympanic membrane, then the cochlea, and there's the auditory nerve, which is the next section after the cochlea. So these disorders cause sensorineural hearing loss. Again, this is the end of the last PowerPoint. We talked a little bit about noise-induced hearing loss and presbycusis. So another disorder that affects the cochlea is Meniere's disease. Occurs fairly frequently in individuals that are between 40 and 60, more so in women than men. It is caused by a buildup of endolymph in the cochlea. Sometimes you'll hear Meniere's disease referred to as endolymphatic hydrops, which essentially means there's too much endolymph in the cochlea. So it becomes the endocochlear pressure becomes elevated. And that can cause a lot of things, from fluctuating hearing loss to vertigo, ringing in the ears. Typically, it's a low-frequency roaring or rushing sound, and then a sensation of aural fullness or ear pressure. And so those are kind of the hallmarks of Meniere's disease. The episodic vertigo can become intractable, where it's so bad they have to basically kill the ear, the balance portion on one side, to stop it. And so, again, it's sometimes called endolymphatic hydrops. And it basically distorts that cochlear structure because of the increase in endolymph. It typically has this kind of low-frequency hearing loss that rises up, but you can see this low-frequency sensorineural hearing loss. There's no air bone gaps here. Here's the left bone, here's the left air, here's the right bone, here's the right air, so there's no air bone gaps. These people, the diagnosis is based on symptoms and then the audiogram. So we'll watch that video, but again, watch it ahead of time. Sudden sensorineural hearing loss. This can happen for numerous reasons: a lack of blood flow, viral infection, autoimmune disease. But some people, and oftentimes they wake up in the morning, they go to use the telephone and they notice, oh, I don't hear anything out of my right ear, and so forth. Or I'm not hearing as well out of one of my ears or both ears. And so sometimes it's accompanied by tinnitus and vertigo. It may recover to some degree or in full degree, but most often, if it's severe enough, they will treat this with steroids to see if they can reduce any inflammation and so forth, to allow the hearing to come back to normal. I've seen it work and I've seen it not work. I've seen people go from normal hearing one day to completely deaf and have very little residual hearing within a couple days. And so they do lots of things to try to bring back their hearing loss. They will give them herpes medicine like Valtrex because it's an antiviral. They will try steroids and lots of different things. Sometimes they will inject the steroids, and by the ENT doctor will inject the steroids through the tympanic membrane, and sometimes they'll give them oral steroids. But this is a very significant cause of hearing loss. And there you'll watch that, and we will go over that. Congenital hearing loss, prevalent at birth. Here you can see kind of the breakdown. 25% it's idiopathic, 25% it's non-genetic, and then 50% of the time it's genetic. Genetic is broken down into non-syndromic and syndromic. Basically, syndromic is associated with some kind of syndrome, but most of it is non-syndromic, meaning that it's not related to a particular syndrome. Most oftentimes it's recessive, meaning that both parents are carriers of a gene for hearing loss, but they don't have hearing loss themselves. Whereas in the case of dominant inheritance, one individual has that gene and it's passed on. Okay. And then sometimes it's X-linked, but, and I'm not sure if you covered this in any other class, but we will talk and review the recessive versus dominant inheritance. Again, you'll get that multiple times. It could be prenatal or perinatal. So in prenatal, it occurs while the cochlea is developing. Perinatal occurs at or around the time of the child's birth. Some reasons for perinatal hearing loss: lack of blood supply, ototoxic medications, low birth weight, hyperbilirubinemia, which is essentially a big word for excessive jaundice. Jaundice is essentially a buildup of bilirubin in the blood. It's not being secreted correctly, and then many of these children who have severe jaundice will require some phototherapy to help it break apart in the blood and be filtered out. And then you'll watch that, and we'll go over that. So other types of inner ear problems, you'll hear of the torch disorders, a group of disorders, toxoplasmosis, which is usually syphilis or HIV, rubella, cytomegalovirus, and then herpes simplex. And so I don't know if we go through each one of those. Yeah, cytomegalovirus is part of the herpes virus. It is very, very debilitating. It can cause way more developmental issues than just hearing loss. Okay, kids with cytomegalovirus often have numerous cognitive issues, physical issues, motor issues, all of that. And so if you've never seen a patient with CMV, when you do, you'll see how severe it is. And we're going to watch that video. One thing that wasn't mentioned there, so I should go back, is toxoplasmosis is essentially a bacteria that's transmitted through they'll talk about watching pregnant women. Be careful when you're changing litter boxes for cat and dealing with cat feces. We typically, when you get your MMR, your mumps, measles, and rubella vaccine, this was essentially eradicated, but I think you're seeing cases now because not to cast judgment on anybody, but not everybody's vaccinating their children. And so you'll see cases of measles, mumps, and rubella popping up again. And then the herpes family of viruses. Okay, we talked about CMV. You're going to watch a video. We'll talk about that. Syndromic hearing loss. Some of the syndromes, Usher's, Alport, and Waardenburg syndrome, are the three most common types of syndromic hearing loss. Usher's has visual and auditory impairment. Alport has kidney disease, has some hearing loss and some eye abnormalities. And then Waardenburg has some specific outcome or manifestations as well. So this is more common. Waardenburg, typically you'll see the wide set eyes. You'll see, not in all cases, maybe in like 15-20% of the cases, you'll see this white forelock. You may see heterochromia. This child doesn't have it, where they have two different color eyes, and other craniofacial abnormalities. And most times the hearing loss is, of course, sensorineural, and can be profound. Okay, But hearing loss doesn't always present in cases of Waardenburg syndrome. And that will be an example there. We'll watch the video. Okay, so that's it for this portion. We'll touch base and go over some additional outer ear disorders covered in the chapter.